Hi, my name is Dr. Robin Abramczyc, and the name of my practice is Smile Ranch Dentistry. And one of the things that I do here is frenectomies on patients who have a tight either attachment on the upper lip or under the tongue. And so the purpose of this video is for post-op instructions and some pre-op instructions so that parents are more familiar whenever they come into my office. So a few things that I really do emphasize and require of my patients is that they work closely with an IBCLC or lactation consultant and also with a body worker. Now you can choose your body worker, whether it be a craniosacral therapist, a chiropractor, a myofascial therapist. There are a number of body workers that can actually help your baby through the healing process, and then also working with a lactation consultant. And I recommend that we start that earlier. The reason is because sometimes actually working with a lactation consultant and body worker can actually prevent the release from being necessary. So if that is an option, that would be wonderful. However, there are times whenever a release is necessary, and so whenever the baby does latch work, they improve their latch, and whenever they have working with a body worker, the doctor can actually get in and do a better release. So very important that we start the body work before the release, if at all possible. But if not, it's not the end of the world. I do require that the patient, when they're done with their release, they do work with a lactation consultant and a body worker. I also recommend that the parents watch the video on stretches, which is on my YouTube channel, Smile Ranch Dentistry, and on my Facebook page. So learn how to do the stretches, be informed before you come in, and I would actually start doing those before so that the baby and the parent can get used to that. That is setting the parent up for success, and the baby up for success. So a couple of things I just wanted to talk about is during the procedure, how do we do that? Well, we put some numbing jelly. If the parent refuses that, that's fine, but I feel better about it, and most parents feel better about putting a little jelly on the surgical site so that the baby is more comfortable. Another thing is we wrap the baby to secure them in a little snuggly wrap, and I have a couple assistants in there that are helping to stabilize the child, loving on them, talking to them throughout the procedure. We also, depending upon the age of the child, we also have little glasses. And one of the assistants actually has these on the baby's head and is holding them in place so that they don't dislodge at all. This is for the little tiny babies, and then we also have another one for the little bit larger size children. Now, for management for pain after the procedure, most babies are sore. So some of the things that I like to recommend is arnica. It's a homeopathic, and this is actually a tablet. You can also get arnica gel. What I have here and available for purchase is the arnica tabs. And what I recommend is that mom or dad crush up the tabs in a little bowl, and then you can add either breast milk or water. And it's not an exact science. I would say half a teaspoon, maybe a teaspoon with 2 tabs. Crush it up, draw it up in a syringe, and then I would start dosing the baby whenever the parents get home, every half hour. Now, in about 4 hours from the time that I apply the topical, the baby will start getting fussy usually. And that's whenever you want to start frequently dosing with the arnica. You can give it every 15 minutes without worry of any toxicity of any kind, and just in a syringe. How much do you give? Again, it's not an exact science. I would just express a little bit into baby's mouth, and it will just fill up their tissues, and they'll swallow a little bit, but make sure that you're not giving too much where they choke. That loaded syringe, I would keep it refrigerated because it's soothing to the baby, and again, you want to dose every 15 minutes as long as baby is fussy. If baby's not fussy, you do not need to give the arnica anymore, okay? So that's really important. I always emphasize trust your instincts. If you feel like the arnica is not managing the baby's discomfort, then please consider giving something stronger like Tylenol, and consult with a pediatrician on the dosages on that. I do have it in my paperwork, so that is something that we'd like to discuss at the parent appointment. Another thing is, for the stretches, I recommend using coconut oil. Again, this is in my office for purchase, and I love using coconut oil. It's antibacterial. There's a lot of benefits to using coconut oil. So whenever the parent is stretching the surgical sites, the hands should be cleaned thoroughly, and then you can use just a little bit of the coconut oil. It's nice and slippery, and it's comforting to the baby. Another thing that is comforting, because most babies are sore, they're not going to want to move, is using chips, little milk chips. So you can freeze a really thin layer of milk, of breast milk, in the freezer, and then use tiny little milk chips in their mouth. Just use enough to your discretion where they will not cause a choking hazard. And again, just giving those every few minutes. Now, some babies are swollen under the lip or under the tongue. That's normal. Usually swelling can last a few days or maybe even 4 days. Again, something that's cold is really going to be soothing, and it feels really, really good to the baby. If the baby does go on a hunger strike or is refusing to eat, that usually lasts about 5 hours max, maybe 6, but I would try to get some fluid in baby. So some of the things that you can do, if they're refusing a bottle, you can even syringe feed. You don't need to inject everything at once, just slowly administer some of the milk to the baby. If they're refusing that, then you can even try doing finger feeding, and sometimes that works really well. So another thing that I like to recommend, and it's quite popular today, is amber necklaces. And so at my office, we carry a line of amber necklaces by Baltic Amber, and they're really pretty, and we have the mom and baby necklaces to match, but it definitely helps with pain. I use it for sciatica. It's often used for teething as well. So one of the things that parents are concerned about is baby's fussiness. So after the procedure, most babies are fussy. It's usually a couple of days, sometimes not at all. Sometimes a baby can be really fussy for about 5 days. So I do have a video that you can watch on this with Deidre Goodman. You can watch to get information about that. But it's normal, it's to be expected for most about a couple of days. You really just want to cuddle the baby, do a lot of skin to skin, warm baths, move around with the baby, listen to music. Make sure you're doing plenty of tummy time also. You may want to take the baby outside, change the environment, and see if that helps. Very important. And on the stretches, we're setting you up for success. So your homework is to do the stretches appropriately in the number of times that we tell you to. So the first night it's at dinner, and then starting on the second day, 6 times a day. I recommend doing that 6 times a day for 3 weeks, and then you can drop down to 5 times a day, 4, 3, 2, and 1, dropping down 1 time per week. Also working with your lactation consultant and with your body worker. Those babies that work with a body worker and a lactation consultant always do better. Okay, so that's very important. Thank you so much for joining us today, and please do call us if you have any questions.